Oops. Okay. All righty. Hi, everyone. This is Nurse Ed Scholar here. And I decided that before I really kind of start on nursing content, that I was going to kind of, in my last video, I was talking about um, expectations in clinical. And I guess got a little out of order. So I'm trying to get things organized. So I'm going to talk today about, the expectations of an entry level registered nurse and the licensure exam. So that's going to be what I'm going to talk about for the next couple of videos. Prior to really like getting into nursing content, I don't know if your program is the medical model or you're doing conceptual nursing, but either way, we'll start getting into nursing content. But I think, understanding the expectations of a registered nurse and then really understanding what's being taught on the licensure exam is really important. And I just wanted to start off with that. Okay, so let's begin. So there are licensure authorities. So and y'all may know of this as the State Board of Nursing. So there are licensure authorities that regulate the entry into nursing practice. So why do they? I'm assuming like we need a license, but really, why do you need a license? And with a license, it's ensuring that the public will be protected. Um, and that you as a candidate or soon to be candidate, or even if you're starting school or thinking about it, it's ensuring that you're going to provide safe and competent care. And that's what the biggest thing is about nursing, is providing safe and competent care. And because as an entry level nurse, you're going to be required to make a lot of complex decisions while delivering care. And depending on what area you start off in or where you work, a lot of new nurses, they're going straight into ICU. And that's going to require for you to make a lot of decisions quickly, difficult decisions. So as you're in school, you're going to hear a lot about clinical judgment, critical thinking abilities. All of those things are going to be essential. You're going to hear about why a clinical assessment is so important. And if you really think about it, when you start off with your clinical assessment, it is providing you the information regarding your client's health status. So you need that information to kind of guide you to where you need to go with your nursing care. And along with that, it's how can I keep my patients safe? What do I teach my patient when it comes to health promotion? All using that with the nursing process. Then you're, also thinking of what ethical considerations do I have to consider? So all of these things, not just the assessment alone, all of these things go into developing your plan of care. And then on top of that, you got to think of cultural considerations, spiritual considerations, so it's all of these things. And that's why nursing is so complex. You'll hear a lot, if you haven't heard, that nursing is art and science. You know, we have to know how the human body works, the certain, the human uh human conditions, medical diagnoses. We don't diagnose and treat, but we're going to have to understand how the human, the patients that we, care for, how do they interact with their environment? How do they interact with their relationships with other people? So, and also understanding that nursing evolves. It's growing, it's growing, it's evolving, it's evolving. So we're going to have to use those critical thinking skills, those clinical judgment skills, the skills that we learn in in clinical uh, and simulation, using all the new technologies that they have to kind of promote or facilitate, the learning of the nursing student. Because all of these things, you have to understand, we're there to protect our patients, um, to promote their healing, um, to make sure that we provide, or we have dignity, I guess you can say, for our patients, especially our dying patients. So there are a lot of things that go on with being a nurse. And I think that's why I really wanted to kind of really start off this way of telling people, or telling future nurses, that nursing is very complex. But once you get it, you got it, but it's just getting there. And so hopefully with these, videos coming up, and with myself and other nurse educators, out there, that we can help facilitate your learning and get you more excited about um, becoming a registered nurse, or, going through the process of becoming a registered nurse. So I just want to kind of reiterate what I said before. I just want to kind of say it again, that when you're looking at nursing, it requires the ability to apply knowledge, the skills that you have learned in class and in clinical, using clinical judgment, and all of these things, you know requires complex thought processes. Realize that nurses are irreplaceable. We contribute to patients' health, helping them to have optimal health. But all of this, really, with all of the things that I kind of mentioned, we're doing all of this and still have to abide by the rules of nursing practice. So we have to know our scope of practice. Sounds like a lot. It's not. While you're in school, and while as you're going through school, it'll become easier. So I think that's about it. I'll be back in the couple of videos, just kind of expanding on licensure, and what competencies they're looking for. So thank you for watching. Please like and share. Thank you. And I don't know, this Nurse Ed Scholar, and I'll see you soon.